Okay, hello, my name is Megan Baxter, and I did the article about recent injury and health-related quality of life in adolescent athletes. I think it's an important topic because 30 million adolescents participate in organized sports in the U.S. Adolescents suffer from 12 million injuries annually and miss about 20 million school days combined. There are a growing number of adolescent athletes in the U.S. That leads to an increase in injuries due to the adolescents participating in athletics. Having an awareness about all the factors associated with injuries is something healthcare professionals need to do better. They need to assess injuries in a different way than they are, not just physical pain and functioning. They need to look at more of the cognitive level. Coaches, healthcare providers, and parents should be more informed about adolescent sport injuries. Looking at health-related quality of life, HRQOL, in other words, is an important concept in all rehab practices to assess injuries in different patients. Incorporating patients' self-reported data with physical injuries can provide a more thorough assessment for healthcare professionals. So the article was done on 205 student athletes, 160 uninjured, 45 injured. The authors used a cross-sectional study to conduct the study. The independent variable was injured versus uninjured athletes, adolescent athletes. The three surveys administered were the brief questionnaire, short form 36, and the pediatric outcomes data collection instrument. The self-reported results showed that 22% of the adolescents were injured, mostly to the lower extremity. Overall, students with injuries scored lower on the HRQOL than uninjured peers. Results also showed injured athletes' injuries go beyond just physical components of health. So I agree with the author's conclusions on this. Adolescents with self-reported injuries had lower HRQOL results than adolescents without injury. The results support my own experience as a high school softball coach. I coach a local high school team in my state. My experience with coaching adolescent girls that I've seen is that injuries take a toll on them, whether it's mentally or physically, or both. So if you get a concussion, it actually is like a big deal. You get neurological problems because it's an actual bruise in the brain, but it also goes into the physical component where you get headaches, and it increases your pain. Your social functioning goes down because you're in pain all the time, and it's just a big combination of stuff I've experienced that people become depressed throughout my experience. The same thing for something as different as a meniscus tear. They have physical pain. They have a decrease in physical functioning. They can't do what they used to do. But they also have a decrease in socialization, and they just are not the same person. They're depressed because they can't be on the field. They can't do what they normally would do by themselves, and they need help. So that definitely goes beyond just physical functioning and pain as well. It goes more into cognitive problems and just being able to be themselves. I think more education is needed in this topic. Definitely with parents, coaches, healthcare providers, but also teachers as well. Because when these kids are in the classroom, teachers need to watch them and realize that they are, most of the time, they're not going to be themselves. They're not going to be able to do stuff, especially with concussion. You're not able to do most of the stuff you're able to do. I've had a couple concussions in my life, and they are not fun. Teachers need to realize the signs too, that a child is hurt, and they need to be able to go to the parents and help them, as well as the coaches, and then the healthcare professionals need to be able to assess the student athlete with the same kind of respect for their injuries and take all the components of health into consideration when assessing. All right, thank you.